Hi friends, welcome to Pharma Mitra channel once again. Today we are discussing the part 2 of the absorption chapter under biopharmaceutics and pharmacokinetics subject. As per the suggestions and comments, today onwards we can meet with small sections compared to lengthy section to avoid your dryness and to improve your listening. Today we are going in depth into the dosage formulated factor under the pharmaceutical factors. The first part we have already covered. Second, the dosage formulated factor or pharmacotechnical factors coming under the absorption chapter. Please like the videos and support me. If you are not subscribed till now, please subscribe and press the bell button to get further notification. Suggestions are welcoming. Well, we can go in depth into the dosage form factors or pharmacotechnical factors. It includes 5 points. First one, disintegration time. Second, manufacturing and process variable. Third, pharmaceutical ingredients or excipient. Fourth, nature and type of dosage form. And fifth one, product age and storage condition. First dosage form factor, disintegration time. Disintegration time or DT is important in case of solid dosage form like tablet and capsule. Normally, to find the disintegration time, we are checking the in vitro disintegration test. But this in vitro disintegration test show no guarantee to find out the drug's bioavailability because sometimes the disintegration of particle is not proper and we cannot find out the absorption rate, and the absorption is sufficient or not we cannot find out. The coated tablets, especially the sugar coated tablets, having the long disintegration time. Rapid disintegration time is very important for the therapeutic success of the solid dosage form. Disintegration time is directly related to two factors, that is the amount of binder present as well as the hardness of a tablet. Simply we can tell, if a tablet is harder means it is having large amount of binder. So this harder tablet requires long disintegration time. That is, after the disintegration process, this solid dosage form should be converted into fine particles, and this fine particle after undergoing dissolution converted into tiny particles and move into solution form. Second factor, manufacturing or process variables. The dosage form related factor that influence the dissolution are: first one, the excipient. It includes the formulation ingredient. Second is the manufacturing process. The influence of excipient can be discussed in the third factor. Here we are going into the manufacturing processes. Several manufacturing processes influence the drug dissolution, and the process important in the manufacturing tablets are its method of granulation as well as the compression force. While considering the method of granulation, the method of granulation are wet granulation, dry granulation, compression method, etc. And wet granulation is the most conventional method. Here the tablets are dissolved faster. But there is limitation in case of this wet granulation method, that is, formation of crystal bridges by the presence of liquid, and the liquid may act as a medium and affecting the chemical reactions, and here the drying step may harm the thermolabile drugs. These are the limitations of wet granulation. The wet granulation involves a number of steps, and the method of direct compression has been utilized to yield tablets that dissolve at a faster rate. One of the most recent methods that resulted in superior product is the APOC method, that is the agglomerative phase of combination APOC, and the process yield the stronger product. And the process involved here, we are grinding the drugs in a ball mill to affect the spontaneous agglomeration. The tablets of produced are stronger and show rapid rate of dissolution in comparison to other method. The reason is that here it is increase in the internal surface area of granules other in case of APOC method. Second factor that affect the manufacturing of tablet is the compression force. The compression force influence the tableting process are the density, porosity, hardness, disintegration time, and dissolution of tablets. Based on the rate of drug dissolution versus compression force, there are four curves we can obtain, that is the linear curve or opposite curve and two bell-shaped curve with different diagram. If the compression force is higher, that shows increase in density and hardness of the tablet, where porosity decreases and penetrability of solvent is there, which produces a slower dissolution rate. At the same time, this higher compression force can cause deformation or crushing or fracture of the drug particle in the smaller one, and here there is a chance of converting the spherical granule into the disc-shaped particle, that is producing an effective surface area. In such cases, there is a chance of increase in dissolution rate. This is the type A curve and this is a type B curve, and in some cases there is a combination of both curve A and B is also possible. In short, we can tell that the influence of the compression force is difficult to predict, and thorough study of each formulation is very important to ensure the better dissolution rate. Third factor, dosage related factor, is pharmaceutical ingredient or excipient or formulation factors. A drug is rarely administered in acid form. Normally, we are adding the number of excipients to ensure the acceptability, the optimal availability, uniformity of the dosage form, etc. If more the number of excipients are there is greater potential and bioavailability problems are there. The commonly used excipient used in various dosage forms are vehicle, diluent, binders and granulating agent, disintegrant, lubricant, coating, suspending agent, emulsifier, surfactants, buffers, complexing agent, colorants, sweeteners, and crystal growth inhibitors. Among this, first of all, we can discuss into the vehicle part. The vehicle or the solvent system is a major component of liquid orals as well as the parenterals, and three categories of vehicles are the first one, aqueous vehicle, example water or syrup. Second one, non-aqueous water miscible vehicle, example propylene glycol, glycerol or sorbitol. And third one, non-aqueous water immiscible vehicle, example vegetable oil. Bioavailability of the drug from the vehicle depend mainly on its miscibility with the biological fluid. This is the basic concept, that is, the vehicle should be miscible with the biological fluid for better bioavailability. In case of aqueous and water miscible vehicle, which is miscible with the body fluid and the drugs, so here the drugs are rapidly absorbed. A drug which is more soluble in water miscible vehicle, example in case of propylene glycol, it also produces better bioavailability. In some cases, there is dilution of such vehicles are happening. Here, precipitation of drug as fine particle occurs and they dissolve rapidly. Solubilizers such as polysorbate AT are sometimes used to promote the solubility of a drug in aqueous vehicle. But in case of water immiscible vehicle, the rate of drug absorption depends upon its partitioning from oil phase to aqueous body fluid. That is, before that we are telling about the water miscible. In case of water immiscible, we have to consider the partitioning from oil phase to aqueous body fluid. Viscosity of the vehicle is also an important factor that affect the absorption of the drug. That is, the diffusion in the bulk of GI fluid and thus absorption of the drug from a viscous vehicle may be a slower concept. Second excipient is the diluent, otherwise known as the filler. The diluents are commonly added to the formulation if the required dose is inadequate to produce the necessary bulk. That is, to increase the bulkness of the product, we are simply adding the diluent. This diluent may be either organic diluent or inorganic. Among organic diluent, the carbohydrates are very widely used. For example, in case of starch, lactose, microcrystalline cellulose, etc. And these organic diluents are used in case of hydrophobic drugs. And in case of inorganic diluent, that is in case of dicalcium phosphate or DCP, is the most common inorganic diluent. Classical example of the drug diluent interaction resulting in poor bioavailability is that of tetracycline and DCP. DCP means dicalcium phosphate. Here the tetracycline and divalent calcium phosphate form a complex which is poorly soluble and unabsorbable. Third excipient is the binders and granulating agent. The binders are the materials which are used to hold the powder together to form the granule. That is, to form a granule we have to add binders or granulating agent. To produce granules or compact, or to form the compressible material we have to add binders and granulating agent. The popular binders used are starch, cellulose derivative, acacia, polyvinyl pyrrolidine, etc. Others include such as gelatin, sugar solution, etc. Generally, the fillers, the hydrophilic aqueous binders show better dissolution rate with poorly wettable drugs. If large amount of binders are added in the dosage form, there is a chance of increase in the hardness. Next point is that PEG, that is polyethylene glycol 6000, is a delta-Lewis binder for phenobarbital because it forms a poorly soluble complex with the drug. In case of non-aqueous binder, that is in case of ethyl cellulose, this ethyl cellulose can retard the drug dissolution process. Fourth excipient is disintegrant. That is, the disintegrants can overcome the cohesive strength of the tablet and break them up into the contact with water, which is very important in case of dissolution process. That is, if the decrease in the amount of disintegrant, that show there is lower bioavailability. Almost all disintegrants are hydrophilic in nature. The adsorbing disintegrant, that is example bentonite, vegan, etc. In such cases, we have to be avoid low doses drug, that is low dose drugs such as digoxin should be avoided since the large amount of dose is permanently adsorbed and only fraction is available for absorption process. So Adsorbing disintegrant should be avoided in case of low dose drug to avoid the adsorption process. The microcrystalline cellulose is also a very good disintegrant, but at higher compression force, there is a chance to retard the drug dissolution process. Fifth pharmaceutical ingredient is the lubricant or anti-frictional agent. These are the agents added to the formulation to aid the flow of granule to reduce the interparticle friction as well as the adhesion of particle. Commonly used lubricants are hydrophobic in nature, and this disintegrant get coated with the lubricants normally. Sixth one is of coating. Generally, this coatings having an effect on the drug dissolution, and this effect is enteric coating greater than sugar coating greater than non-enteric filling coating. And the dissolution profile of certain coating material changes on aging. That is, for example, in case of shellac coated tablets, that is, shellac is coated on prolonged storage, it will dissolve more slowly in the intestine, and however can be prevented by incorporating PVP into this coating formulation. That is, in the case of shellac coated tablet, there is a chance of dissolution on long term storage. To prevent for that, we can add to the coating plus PVP is added in the formulation. The commonly used excipient used in various dosage forms are vehicle, diluent, binders and granulating agent, disintegrant, lubricant, coating, suspending agent, emulsifier, surfactants, buffers, complexing agent, colorant, sweeteners, and crystal growth inhibitors. Among this, first of all, we can discuss into the vehicle part. The vehicle or the solvent system is a major component of liquid orals as well as the parenterals, and three categories of vehicles are the first one, aqueous vehicle, example part rose syrup. Second one, non-aqueous water miscible vehicle, example propylene glycol, glycerol or sorbitol. And third one, non-aqueous water immiscible vehicle, example vegetable oil. Bioavailability of the drug from the vehicle depend mainly on its miscibility. Eighth factor is of surfactant. Surfactants are widely used in the formulation as whitening agent, solubilizer, emulsifier, etc. They may enhance or retard the drug absorption either by interacting with the drug or by membrane or both. And the mechanism involved in increased absorption of drug by use of surfactants are promotion of the wetting, that is through the increase in effective surface area and dissolution. Example, in case of polysorbate 80 with phenacetin. Second, by better membrane contact of the drug for absorption. And third, through the enhanced permeability of the drug. The beneficial effect of the surfactants are at pre-critical miscellany concentration level, there is beneficial effect is observing. The physiological surfactant like bile salt, anionic, lysolecithin which is non-ionic, promote the absorption of this hydrophobic drugs. And that is in case of hydrophobic drugs, example steroid, oil soluble vitamin, etc. They will produce a micellar solubilizing property. In the presence of surfactant, there is decreased absorption of drug chance is also there, and this decreased absorption of drug due to the presence of surfactant is due to two reasons. First of all, due to the formation of unabsorbable drug miscellany complex at surfactant concentration that is above the critical micelle concentration. And second is due to the laxative action induced by a large surfactant concentration. Ninth excipient is the buffers. Buffers are useful in creating the right atmosphere for the drug dissolution. That is very helpful in case of buffered aspirin tablet. But certain buffer systems containing potassium cation that inhibit the drug absorption. That is seen in case of vitamin B2 and sulfanilamide. The reason is that by uptaking of fluid by the intestinal cell due to the effective drug concentration get reduced and the absorption rate is decreased here. That is why the buffer system containing potassium cation inhibit the drug absorption. Such inhibitory effect of the various buffer cation are representing here, that is potassium greater than, ammonium ion greater than, lithium plus ion greater than, sodium ion greater than, tris hydroxymethyl aminomethane. Hence, the buffer system should contain the same cation as the drug salt, and here no additional cations are added. 10th excipient is the complexing agent. The formation of complexation or complex formation can alter the physicochemical as well as the biopharmaceutical property. A complex drug can alter the stability, solubility, molecular size, partition coefficient as well as the diffusion coefficient. Basically, such complexation processes are pharmacologically inert. Several examples are there where complexation has been used to enhance drug bioavailability. That is, enhanced dissolution is obtained through the formulation of soluble complex. That is, complexation become useful to enhance the drug bioavailability. First, in case of enhanced dissolution through formation of soluble complex. Example, ergotamine tartrate caffeine complex and hydroquinone digoxin complex. Second, enhanced lipophilicity for better membrane permeability. Example, caffeine PABA complex. Third one is the enhanced membrane permeability, that is enhanced reabsorption of heparin is there in presence of EDTA complex, which chelates with the calcium and magnesium ions of the membrane. These are the cases or example where complexation is used to enhance the drug bioavailability. But complexation also reduces the absorption. For example, in case of complexation of tetracycline with divalent and trivalent cation like calcium that is present in milk, antacid, etc., iron that is present in hematinics, magnesium that is present in antacid, and aluminium. In such cases, complexation of tetracycline will occur and which result in reduced absorption rate. 11th excipient is colorant. Even a very low concentration of colorant they are adding can produce inhibitory effect on the dissolution rate. That is, this dye molecule get absorbed and inhibit the drug with dissolution. Example, in case of the dry brilliant blue, it will retard the dissolution of sulfur thiazole. And this dyes also inhibit the micellar solubilizing effect of bile acid, that is, that impair the absorption of hydrophobic drugs like steroid. 12th excipient is the precipitation or crystal growth inhibitors. That is, in free drug concentration is increasing above saturation, it results in supersaturation level. That may result in precipitation or crystallization. That is, if the free drug concentration is above the saturation, the drug may precipitate or result in supersaturation process. In such cases, we have to add the precipitation or crystal growth inhibitors such as PVP, polyvinyl pyridine, SPMC, PEG, and PVA. And the hydrophilic polymers prevent or prolong the supersaturation and prevent the precipitation by increasing the viscosity of the vehicle and by preventing the conversion of highly energy metastable into stable form and by adsorbing on the faces of crystal. Fourth main factor affecting the dosage form is the nature and type of the dosage form. For a given drug, that is a 2 to 5 fold difference is there with the different types of dosage form. That is, absorption rate vary, that is from tablet to solutions. That is, the tablet will disintegrate into granule, then fine particle dissolve a drug in solution form and convert into the drug that enters the blood form. That is, according to the dosage form or type of the dosage form, the dissolution or absorption rate will vary. The bioavailability of a drug from various dosage forms are given, that is solution greater than emulsion greater than suspension greater than capsule greater than tablet greater than quarter tablet greater than entry quarter tablet greater than sustained release product. First one, in case of solution. That is, if a drug is in the solution form, that is the main thing, that is getting better absorbed. Here, the drug dissolution process is absent and factors influence the bioavailability are the nature of the solvent, viscosity, surfactant, solubilizers, stabilizer, etc. In case of the dosage form emulsion, here it is superior to suspensions and observe that in case of indoxol, it is an NSAID, that when it is dissolved in vegetable oil and emulsified, the absorption can be increased to 3-fold. That is, the drug administered in an oily vehicle can direct the distribution directly into the lymphatic system, thereby avoiding the first pass embolism. In case of suspension, the major rate limiting step is the drug dissolution. It is rapid due to the larger surface area and of the particles. Fourth dosage form is the powder. Here we have to consider the handling and palatability problem, but is here nowadays we are not using. Fifth one is the capsule form. The powders and granules are properly administered in hard gelatin capsule as well as soft elastic shell. In case of hard gelatin capsule, we have to consider the drug particle size, density, polymorphism, etc. Hydrophilic diluent like lactose will improve the wettability, deaggregation, etc. And hydrophobic drug with a fine particle size we have to consider, otherwise clumping may occur. This clumping effect can be overcome by incorporating the hydrophilic diluent, that we can add up to 50% and a small amount of wetting agent cum lubricant such as SLS to convert into impermeable powder. In case of soft elastic capsule, it will dissolve faster than hard gelatin capsule and show better bioavailability from oily solutions, emulsions, suspension, etc. But in case of soft gelatin capsule, there's a problem, that is a high water content of the shell, that is about 20%. And this moisture or water content migrate into the shell content. Crystallization may occur during the drying stage and affect the drug dissolution. The wet granulation involves a number of steps, and the method of direct compression has been utilized to yield tablets that dissolve at a faster rate. One of the most recent methods that resulted in a superior product is the APOC method, that is the agglomerative phase of comminution, APOC. and the process yield the stronger product. And the process involved here we are grinding the drugs in a ball mill to affect the spontaneous agglomeration. The tablets were produced are stronger and show rapid rate of dissolution in comparison to other method. The reason is that here it is increased in the internal surface area of granules other in case of APOC method. Second factor that affect the manufacturing of tablet is the compression force. The compression force influence the tableting process are the density, porosity, hardness, disintegration time, and dissolution of